we put probe in the breast and we will differentiate whether it is a cystic swelling or solid swelling. So these are the different type of mammographies. Next one. So these are the X-ray picture of mammography. In this X-ray picture, you'll be able to see the lump whitish. These are crystal white is the cancerous. So when the lump is not a superficial lump, is close to the some pectoralis major muscle, close to the bone and close to the chest wall, we can't uh, evaluate through the palpation. So we do mammography. These are the picture of mammography. Next one, please. And this is the sonomammography. Sonomammography, we differentiate the cystic structure from solid structure. These are the picture of sonomammography. Next one. And there is one type of mammography is the MRI mammography. MRI mammography is a very costly procedure. MRI mammography not easily available in every city. Right now, in some center in Jabalpur, they are doing MR mammography. MR mammography is safer than X-ray mammography because in X-ray mammography, we expose with the X-ray. When high risk women do yearly X-rays, so they will expose the X-ray. But MR mammography is safe because in MRI, as we know, MRI don't emit X-ray because this is the magnetic images. So in this mammography, if you see the this red circle, this is the lump, very minute lump we can pick through the MR mammography. Next slide, please. So these are the international guideline. In every guideline, ACGO, ACR, ACS, they recommend up to every woman should do mammography, or every guideline they recommend annual mammography. And if a woman having high risk woman, they should begin at the early age, around 30 to 35 years. So these are the international guidelines when and how to do mammography. Next one, please. And then diagnosis. So there are different tool of diagnosis: mammography, MRI, ultrasound, biopsy, image guided biopsy, and surgical biopsy. Next one. So we need to differentiate if women come with a lump. She said, "Sir, we having lump in our breast." So we need to diagnose whether it is cancerous or whether it is benign. So we have lots of modality to diagnose. Next one, please. First one is FNAC. FNAC means fine needle aspiration cytology. So we put syringe in the breast lump and aspirate some of the cells, and we spread the cells in the glass slide and we see in the microscopy. And sometimes we need to do under the guidance of ultrasound. If some in bulky patient and big breast patient, lump health fatty patient, if the lump is deep, so we need to uh, uh, delineate the lump by ultrasound probe. Next one, we prepare the slide. Next one, please, and see in microscope. In microscope, we see the structure of the cells. In cancerous cells, there are the normal cell are different and cancerous cell are different. In cancerous cell, the nucleus is very large and nucleocytoplasmic ratio is disturbed. So we differentiate the normal cell and cancerous cell. So there is a special pathologist called oncopathologist. They diagnose the normal cell or abnormal cell. So FNAC is very much safe for diagnosis the patient because the rumor in the society, if we do FNAC, the tumor will spread. So lots of women, they have very much fear to do FNAC. So we need to know that in FNAC the cell or tumor not spread. Okay, this is a very safe procedure, or we need to do FNAC because without FNAC we can't define whether is lump benign or malignant. Next one, please. So these are the mammographic guided affinity of